Friends. So today I'll be talking on this 60th COVID-19 update on post-ICU outcomes. So for all my good friends, I'm on my seventh day of my quarantine myself. So I thought I would review this particular topic, which is very relevant to anyone who is recovered from COVID. So I'll be returning to work tomorrow. So I thought I'd just do this recording. So this particular talk is derived at even a previous talk on long-term ICU outcomes, but today this is about a journal review which came just few days ago on 24th Jan 2022 from the Dutch group. So the title of the study is Clinical Outcomes Among Patients with 1 year Survival Following ICU Treatment for COVID. So this came in JAMA. So probably this particular article wouldn't be applicable to any COVID recovery in a non-ICU setting, possibly, because this was predominantly to look into ICU patients who survived COVID from ICU. What is their long-term outcome? So the importance of this particular study is there has been no studies to really look at what has been the 1 year outcome of patients who survive ICU treatment from COVID with regards to physical sort of a symptoms that persist, mental symptoms and cognitive symptoms. And it has been shown very clearly that post ICU, someone who carries along symptoms of physical, mental or cognitive has a bearing on increase in the 1 year mortality and increase in the cost for the patient and reduced quality of life. So this is fairly intuitive and this is quite applicable for non-COVID patients also. And this has been demonstrated in the previous studies. So this was a prospective multi-center cohort study in 11 Dutch hospitals in Netherlands. So this was done between 1st March 2020 to 1st June 2020. And the number of patients enrolled were 452 who were more than 16 years of age. So final follow-up was on 16 June 2021. So this is a bit about the methodology. So it was a cohort sort of a study done over 3 months in 2020. So what were the main outcomes and measures? So what they really looked is they divided the symptomology into physical, mental, and cognitive, and they gave questionnaires to all the patients who were discharged from ICU. And they looked at clinical frailty score as more than or equal to 5 as being. So these were all the questionnaires of frailty index, which was given to the patient and they had to self-answer them. And anything more than or equal to 5 was considered positive. And for the fatigue component, they had a fatigue sort of a scale and more than or equal to 27 constituted as a significant fatigue component that prevailed. Then they looked at the prevalence or occurrence of anxiety using hospital anxiety depression scale, and any score more than or equal to 8 was considered significant. And they looked for depression using the hospital anxiety depression scale. Again, score more than or equal to 8 was considered as significant. And for post-traumatic stress disorder, they used a scale and more than or equal to 1.75 was considered significant. And for cognitive impairment, they looked at cognitive failure questionnaire with lot of mini mental sort of a questionnaire, and more than or equal to 43 was considered as significant. So these were some of the criteria they took as to attach significance to the presence of these symptoms in this particular study. So the mean age of the patients in this study was 61.2. Like any other COVID study, males were more predominantly present. 71.5% of the patients enrolled was males. The median ICU stay of the patients was 18 days and the range was 11 to 32 days. So they looked at symptomology in 245. So the physical symptoms was present in 74.3, where they used clinical frailty score, and physical symptoms which persisted after ICU discharge was present in 74.3%. And the weakened condition, so the fatigue component or the weakened sort of a condition was prevailing in significant proportion of 38.9%. And the mental symptoms were present in 26.2, and these were all significant as compared to the ones who did not have. And the cognitive symptoms, as you see, was present in 16.2%. Again, this was significant. And with regards to body pains, joint stiffness and joint pains were present in quarter of the patients. Around 25 to 26% of them had joint pain and joint stiffness. And muscle weakness was present in 24.8, and myalgia was present in 21.3. So these were some of the physical, mental, and cognitive symptoms that were present or reported in this study. When they looked at mental symptoms, anxiety was present in 17.9%. So 44 out of 246 patients discharged from ICU continued to complain of having anxiety symptoms. And this was compared with the previously reported study, which again came in JAMA from the French group, where they followed up the symptoms for 4 months. Here they followed up the symptoms for 1 year. So 4 months, they had 23.4%. And they looked at depression. It was present in 18.3 in this, and the French study showed 36%. So here depression was not concurrent with the French findings. And post-traumatic stress disorder was present in 9.8% in this particular study. So, and when they compared with the previous study, which came in 2020, so 1/3 of the ICU survivors, which were non-COVID, tended to have cognitive symptoms. And here, when you compare with this particular study, it was 26.2% at the end of 1 year. So this was the comparison they drew with the previous study. And in the discussion, this study is come from Netherlands, and this was a recent study which again had come out from Netherlands in American Journal of Respiratory Critical Care in non-COVID patients, which is called Monitor Intensive Care Study in non-COVID patients. Here they compared the physical symptoms at the end of 1 year. So it was a very similar to the present study where they followed up the patients who were discharged from ICU for 1 year in non-COVID. And they found the symptomology appeared fairly similar to the findings they found in COVID patients. So physical symptoms were 77, and in this particular study, it was 74.3. So fairly similar. So COVID and non-COVID sort of behaved similarly. If you have to compare these two studies, which was done from the same country in COVID and non-COVID. And mental symptoms in that particular monitor IC study was present in 35.5. Here it was less, 26.2. And cognitive symptoms there was 14%, here 16.2. And problem returning to work was present in 43 and here 58%. So all in all, basically, the post-ICU sort of a symptomology, at least the mental symptoms appeared very similar to non-COVID patients is what is being highlighted, comparing between these two studies, which was both done in Netherlands and very similar study of post-ICU sort of a symptomology. With regards to physical, mental, and cognitive, they appeared fairly similar, except mental symptoms were a little more in non-COVID as compared to the COVID. So the limitations of this, the biggest limitations of this study was the whole charting of observations or the symptomology was self-reporting. So which is a huge problem, because when you try to capture the symptoms, even the cognitive symptoms, which is self-reported, there could be room for a lot of biases and errors that may be prevailing. Rather than doing a objective mini-mental status, here patients themselves were asked to report their symptoms in a very subjective way that could have led to a lot of erroneous charting of these observations. And there is no collation of information with regards to the confounding factors like the role of sedation, proning, and the presence of delirium during ICU stay, which would have possibly had an impact on the mental, cognitive symptoms, anxiety, and so on and so forth. And whether there was a confounding factor of post-ICU rehabilitation, which may have had a role with regards to the physical frailty sort of a symptomology that persisted. And there was no comparison or drawn within this study between non-COVID patients to see whether non-COVID patients behaved similarly to COVID in this particular study, albeit the previous study which came, they both appeared concordant with regards to the findings. So all in all, the conclusions of this particular study, it was an extrapolatory study done in 11 Dutch hospital ICUs who were treated for severe COVID in ICU, where they showed that the survivors up to 1 year tended to demonstrate physical symptoms, mental symptoms, and cognitive symptoms, which were predominantly anxiety, depression, and post-traumatic stress disorder, which were all very significant. And that is something that one needs to keep in back of mind in patients who get discharged from COVID from ICU. So thank you, one and all.